It's Mari McInerney from Croaky here at Safer Care Victoria's Giant Steps Conference, and I have here one of the presenters who sadly I missed out on seeing. So would you be able to introduce yourself, please, Ranjana?
Yes, my name is Dr Ranjana Srivastava and I'm an oncologist in Melbourne.
And what did you present on?
So my topic was to talk about difficult conversations and how to navigate difficult conversations in medicine. Difficult conversations are a part and parcel of many different medical encounters, not just in cancer. So I was talking about having a toolkit to serve patients well, and also we know that when we don't manage to have good conversations with our patients, it upsets us as clinicians, it leads to higher levels of stress and burnout. So as much to protect the patient as to protect ourselves, we all need to get better at having good, humane, compassionate conversations with our patients.
So how do you do that? Where's the toolkit and how do you learn it?
Well, I think, one thing that I was talking about was people sometimes assume that communication is an innate skill. And I think that this particular kind of conversation about navigating difficult conversations is not necessarily innate, but it can certainly be learned and it can be honed. And no matter what the particular situation in healthcare, I think there are some simple things that we were talking about in the room that I ask people to remember. Things as simple as, just stop and think about whether this is the right place, the right time, and the right people to have a conversation with. Are the right people in the room? Is this conversation happening very early in the morning or very late at night when the right people aren't around or the relatives have gone away and the poor patient is alone? Talking about sort of how we give knowledge. So, it should be in small bits, in words that a patient can understand. We need to check that a patient has understanding of what's going on. We need to be very mindful that especially people in hospital may not be feeling well, they may not absorb all the information that they otherwise might. And then I talked a lot about the vital importance of empathy and compassion. I think unless you show yourself to be genuine and vulnerable and human, it's hard to have these difficult conversations about a terminal diagnosis or a poor prognosis or an impending death, etc.
So how do you do that? How does somebody who doesn't find it an innate thing demonstrate that they're human in those encounters?
Well, I think it calls for self-reflection, probably, most of all. I think one of the reasons we're not good at talking about bad conversations, difficult conversations, especially about death and dying, is because it feels like a brush with our own mortality. So I think with every conversation in medicine, we have to ask ourselves, did that go well? How could we have done better? And it requires some self-teaching, some teaching by the profession, a lot of self-reflection. And I think like any good conversation, taking cues from the person and from the people around you. It doesn't have to be incredibly stressful and impossible, but if you are able to listen and to respond to emotion, and obviously we come with a set of not skills because we are trained professionals. If you can put it together, it's not as hard as it seems to be.
Are there any obvious don't do's?
Don't assume. I think that would probably be the most obvious don't do that I have learned in my own practice. Don't assume that someone has had a conversation ages ago about their prognosis or somebody has never been told. The flip side, don't assume what people's relationships are like. And as much as possible, ask and listen. And listen to what people are telling you, and also sort of use all your senses to kind of read the emotion in the room. And whenever you are unsure, I think politely and humbly asking someone to explain something is always better than assuming.
Fantastic. Thanks very much, Ranjana.
Thank you.